This is a normal hip joint, where the round head of the femur fits smoothly into the socket of the pelvis, called the acetabulum. Both surfaces are covered with smooth cartilage, allowing painless and fluid movement of the hip. In arthritis, this cartilage wears away. As a result, the bones rub directly against each other, causing pain, stiffness, and swelling. Over time, everyday activities like walking or climbing stairs become difficult and painful. During a total hip replacement surgery, the damaged hip is carefully dislocated. The surgeon removes the worn-out femoral head using precision instruments. The socket, or acetabulum, is then cleaned and reshaped using a special reaming tool, creating the right shape to fit the implant. A metal cup is placed firmly inside the prepared socket. A liner made of plastic, ceramic, or metal is fitted inside the cup, providing a smooth surface for joint movement. Next, the femur is prepared. The surgeon opens the upper part of the thigh bone to create space for the implant stem. This metal stem is then inserted into the femur, and a new ball, made of metal or ceramic, is placed on top. A trial implant is temporarily placed to check the joint's fit, stability, and leg length. Once confirmed, the final implant components are inserted and secured in place. The hip is reassembled, the muscles and soft tissues are carefully repaired, and the incision is closed. After recovery, most patients experience significantly reduced pain and improved mobility, allowing them to return to daily activities and enjoy a better quality of life.